Hello, my name is Dr. Boby Varkey. I am a consultant neurologist at Aster Med City in Cochin. Today I am planning to speak on the topic of epilepsy and seizures. So first of all, the question comes, what is epilepsy? So you know that the brain is made up of billions of neurons or nerve cells which all fire asynchronously, that is, they all fire at different times. Now in certain circumstances or certain diseases, when the cells begin to synchronize and the firing becomes synchronized, then the person undergoes what we call as classical seizures, or when these seizures occur 2 or 3 times in a row, then we call that person an epileptic. So there are many types of seizures depending upon which part of the brain the epileptic discharges start from. So you can have partial seizures, in which case the epileptic discharges start from one particular area of the brain and remain in that area, or you can have generalized seizures, in which case the epileptic discharges start from all over the brain simultaneously and synchronously. In some cases, patients with partial seizures can go on to have generalized seizures. That is when the discharges start from a particular part of the brain and then they become generalized. It's called a partial seizure, which has evolved to a generalized seizure. So what kind of people get epilepsy? Is there a specific group of people who's predisposed to develop epilepsy? So basically epilepsy can develop at any age. It can develop from neonates who are just born to the very elderly. So the different causes of epilepsy vary by the time at which they start and the age group in which they start. So infants generally have some sort of either structural brain lesions or some metabolic problems, or sometimes they have chromosomal disorders which cause epilepsy. As the child becomes older, reaches teenage and becomes older, then a different kind of epilepsy arises, in which many patients have syndromes like absence epilepsies or juvenile myoclonic epilepsies, which are genetic. As the child grows older, then they become more prone to develop acquired cause of epilepsy, either due to head injuries, due to strokes, due to tumors, due to other space-occupying lesions in the brain. And as they grow older and they become more elderly, then they are more prone to diseases such as degenerative diseases such as Alzheimer's disease or Parkinson's disease or other neurometabolic disorders of the brain, which are more prone to produce seizures. So basically the cause of the epilepsy also affects the treatment modality that we use for epilepsy. So for example, if we can find some cause of epilepsy, nowadays we find that many patients have autoimmune cause of epilepsy, that is, specific antibodies in the blood may bind to certain parts of the brain and cause intractable epilepsy. So so in such cases, these patients we will tend to treat them with conventional anti-epileptic medications, as well as using medications such as steroids or immunoglobulin or other medications which affect the immune system. In other cases where the epilepsy is due to a structural cause such as a tumor or bleeding on top of the brain, then we might consider referring the patient to a neurosurgeon who will take the patient up for surgery and remove that specific area of the brain which is causing the seizures. In the elderly, as neurodegenerative disorders are the main cause of seizures, in such patients generally we tend to stick to medications alone. So is there a role for surgery in epilepsy? So generally, a rule of thumb is that about 70%, or 7 out of 10 people with epilepsy will respond to just medications alone. So some patients, in spite of optimal medications, may not respond to medical treatment. Generally, we follow what is called a rule of 2. That is, if the patient has more than 2 seizures a month on 2 anti-epileptics for at least 2 years, then we consider them to be medically intractable. In such cases, we take the patient up for pre-surgical evaluation, and then we subject the patient to a battery of tests, including video EEG, MRI, and certain other specialized tests. If these tests show that the patient has epilepsy which is arising from a particular part of the brain, and that part of the brain can be resected without causing much harm or morbidity to the patient, then we may consider epilepsy surgery. So epilepsy surgery has very good results if the right patient is chosen, and if you select the right candidate, you can get a seizure freedom of almost about 70 to 80% in those patients who have failed to become seizure free on medications. So very often we get the questions from patients: are anti-epileptic medications safe to take? Do they cause any harm? Is there any benefit in taking medications? And some people are very averse to taking medications. So it's very important to know that after decades of research, now we have plenty of anti-epileptic medications that have very minimal side effects and risk profiles and provide a great deal of anti-epileptic control. So the cornerstone of epilepsy treatment, first of all, is to identify what kind of syndrome the patient has. If you can identify a specific cause for the epilepsy, and if you can identify a specific epileptic syndrome, then your doctor will be able to choose the right anti-epileptic for your seizures. And if the right medication is taken, then seizure freedom is guaranteed in almost 80% of patients. The important thing to know about medications is that although some of them do have side effects, in general the benefits of epileptic medications outweigh the risks tremendously, and it is always best in the interest of your safety and health to continue anti-epileptic medications unless your doctor advises you to stop. Thank you.